Welcome, and thank you for purchasing the LifeVac airway clearance device. My name is Brian Sharman. I'm the owner of First On Scene CPR, operating out of Palm Beach County, Florida. I'm a certified CPR instructor with over a decade of experience teaching life safety courses. I'm also a nationally certified paramedic, and I hold the rank of operations captain at a high-volume urban fire department in Southeast Florida. Now, prior to using the LifeVac device, it is important that you follow established choking protocols and immediately dial 911. Now let's talk about the procedures to be followed for choking emergencies involving an adult or child. Step 1. Recognize a complete airway obstruction. Someone who is suffering from a complete airway obstruction will not be able to speak, cough, or make any noise. They may be trying to communicate to you non-verbally by placing two hands around their neck and performing the universal choking sign. If you suspect that someone is suffering from a complete airway obstruction, ask them, "Are you choking?" If they nod their head yes, ask them, "Can I help you?" If the victim is able to cough, encourage them to cough forcefully and attempt to clear the obstructed object from their airway. If the cough was not successful at removing the obstruction from the patient's airway, progress to step number 2, which is to perform 5 back slaps. Position yourself behind the choking victim. Take the heel of your dominant palm and strike the victim in between the shoulder blades on the back forcefully 5 times. 1, 2, 3, 4, 5. If the 5 back slaps were not effective at removing the obstructed object from the victim's airway, progress to step number 3, which is to perform 5 abdominal thrusts. Once again, position yourself behind the choking victim. Make a fist with your dominant hand and place it just over top of the victim's navel. Take your non-dominant hand and place it over top of your fisted hand. From here, roll both hands upwards until your thumbs are facing towards you. Once in position, begin to pull up and in forcefully and continuously 5 times. 1, 2, 3, 4, 5. Now, there may be certain situations where performing established choking protocols are not practical, such as you have a victim who is wheelchair bound or bedridden. Under these circumstances, it is acceptable to bypass steps number 2 and 3 and immediately progress to step number 4. If the obstruction has still not been cleared from the victim's airway, progress to step number 4, which is to implement the LifeVac airway clearance device. The LifeVac can be used with the victim in the laying, sitting, or standing position. I will be demonstrating with the victim in the laying position. Choose the appropriate mask for the appropriate victim. The masks are clearly labeled adult and pediatric. To attach the mask to the suction unit, use the steps of place, push, and twist. Take the stem of the mask and place it in line with the receiving port of the suction unit. Push and give a quarter turn twist. Check the mask to ensure that it is firmly secured to the suction unit prior to use. Now that your device is ready for use, use the steps of place, push, and pull. You're going to place the mask over the victim's nose and mouth. Push down to ensure that the mask is firmly secured to the victim's face. Tilt up on the chin to position the victim's airway. Push down on the handle of the suction unit. Once the handle is depressed, pull the handle upward with a short, swift tug while holding the mask firmly in place. Roll the victim onto their side and attempt to clear their airway of any debris. Also check the mask and the suction unit for any debris. Repeat these steps for up to 5 times. If the object has still not been cleared from the victim's airway, return to following the established choking protocols, and if the victim goes unresponsive at any point, immediately begin CPR. Thank you once again for purchasing the LifeVac airway clearance device. We commend you for taking proactive steps to ensure the safety of you and your community.